Hello, I'm Wen Wei and I'm from University Malaya Medical Center. Today I'll be presenting on the topic exploring the effects of COVID-19 pandemic on hospital pharmacies in Malaysia. This will be the outline of my presentation for today. The recent outbreak of the COVID-19 pandemic has unprecedented effects on the healthcare system around the world, and the pharmacy service in Malaysia are at no exception. Pharmacies are the frontliners and they ensure medications are supplied to both COVID and non-COVID patients during the movement control order. Therefore, we aim to describe the experiences of hospital pharmacies in Malaysia during the pandemic. This was a qualitative study that was carried out in August 2020 where COVID-19 patients were identified from known clusters and in November 2020 when a colleague was found to be COVID-19 positive. The pharmacy department in the University Malaya Medical Center is divided into 5 main areas: the outpatient, inpatient, drug information, manufacturing, and procurement. Pharmacies were purposefully sampled based on the area that they were working to achieve maximal variation. We now move on to results. This was the demographic characteristics of the pharmacies who were recruited. 20 pharmacies were recruited in August and 14 pharmacies were recruited in November. This table summarizes the teams and sub-teams that emerged from this study. We now move on to the first team. Sub-Team 1. Overwhelmed and exhausted by the workload. Patients were discouraged from coming to the hospital for medication refills. Hence, medications had to be delivered to the patients. However, the existing delivery system was inadequate to support the demand as the process was manual. This led to an increase in pharmacists' workload overnight. The pharmacies were reassigned to affected areas to maintain services. Pharmacists were exhausted due to the increased workload. The delivery of medications are divided into 3 processes: receiving the request, screening, dispensing, and packing the delivery requests. Receiving the request for medication delivery was challenging. Requests for medication deliveries were initially accepted over the telephone. However, due to the sheer volume of calls coming through, the pharmacies in farm care could not cope. Subsequently, a Google form was created. However, patients did not know how to fill in the Google form correctly, which resulted in pharmacies having to contact the patients to verify essential details. Pharmacists had to manually screen each prescription to determine if the medications could be delivered. Medications requiring refrigeration, dangerous and psychotropic controlled drugs could not be delivered. Patients also need to have enough medications to last at least 10 days. For all these scenarios, patients had to collect their medications in person. 4 additional steps were required for the delivery of medications. Medications had to be bubble wrapped and placed into a postage package. Patient's address and contact number had to be verified. A tracking number had to be issued and entered manually into the farm care system. Between all this chaos, Post Malaysia decides to upgrade their system. Nonetheless, pharmacies adapted to the exponential increase in workload. They were unable to rest at allocated break times or take leave during this period. This left pharmacists burnt out, leading to medication errors. This relenting stress, burnout, and having to cope with their workload led to mistakes, such as sending medications to the wrong address, dispensing the wrong strength or type of medication. Sub-Team 2. Relationship between pharmacists and patients. Pharmacists received multiple complaints from patients when they were informed that their medications could not be delivered or when they did not receive their medications on time. Nonetheless, some pharmacies delivered medications personally to the patient's home, and patients were appreciative of the assistance that they received. Sub-Team 3. Use of novel experimental agents. Procurement pharmacists faced challenges when trying to procure medications as there were no established guidelines on how to treat COVID-19 patients, especially during the early phase. Besides, globally, there was a shortage in these novel agents. Pharmaceutical companies were also unwilling to release certain medications as they did not want to be held responsible when these drugs were used for off-label indications. Pharmacists were also unable to predict the usage of these drugs and did not want to overstock, as they had to ensure that the budget was sufficient for purchase of medication for non-COVID-19 patients. Pharmacists were physically not allowed to go for ward rounds, hence there was limited assessment in inpatient pharmaceutical care. Manufacturing pharmacists found it challenging to optimize total parenteral nutrition regimens, as they could only gauge the clinical condition of the patient via clinical notes and online discussion with dietitians, doctors, and surgeons. The formulation for the total parenteral nutrition for a COVID-19 positive patient was also different from the usual formulation for non-COVID-19 patients. Hence, experts from other hospitals had to be consulted through online platforms. Procurement of personal protective equipment could not be purchased through the usual tender system, as all forms of advertisements which are required for a tender process through mass media was not allowed. Procurement pharmacies had to latch on the nursing tender to overcome this issue. We now move on to the second theme. Although pharmacists faced multiple challenges at work, they felt respected and received strong support from their family, friends, and neighbors. They were not stigmatized for working in a hybrid COVID-19 hospital, which made pharmacists felt appreciated and less stressed. Pharmacists also had to ask for assistance from their family members for childcare, online schooling, and grocery shopping, as they were considered as essential service and had to go to work. We now move on to the third theme, challenges and adapting to the new norm. When a colleague was tested COVID-19 positive, pharmacists who were in close contact felt lonely, isolated, and stigmatized when asked to go for a swab. They quarantined themselves and felt guilty when they had to work from home. This incident led to changes in the department's operating procedures, and pharmacy staff adhered closely to these new norms. In addition to the fear and anxiety for their personal safety and well-being, pharmacists experienced radical role reassignments where they embraced additional responsibilities. This kindled pharmacists to work together to overcome these challenges in medication delivery, procurement of medications and personal protective equipment, as well as the provisions of inpatient pharmaceutical care. Nonetheless, pharmacists received strong support from their loved ones and were resilient amid these challenges. These are the references which are used in this study. I thank you for your attention. Have a good day and stay safe.